Canary technique number 2, how to scan occlusal surfaces. In this tutorial, we will learn the techniques on how to scan occlusal surfaces of posterior teeth with the Canary system. First, it's always good practice to ensure that the plastic sleeve and tip are on and properly positioned on the handpiece. We will now scan this molar tooth. For example, let's scan the central pit of the highlighted tooth. We want to know, is this stain or is this caries buried in the fissure of the tooth? You can do a quick scan or detail scan to examine this fissure. In this tutorial, I will do a detail scan. After patient is selected, you will need to select the tooth to be scanned. Select the surface, and in this case, we're selecting occlusal. Then take a picture of the tooth and accept the image. One of the tricks in using the camera correctly is to place the tip on the posterior tooth to the one you will be scanning, and then lift the handpiece directly off the tooth surface. This will help bring the tooth into focus. It is best to try and have the entire occlusal surface fill the screen so that we can accurately map the tooth surface. Using the buttons on the handpiece, we're going to scroll through the areas on the grid to the center pit. We're going to line up the tracking beam right into the center pit. In scanning, you need to imagine that you are directing the tracking beam into the tooth surface. The beam can detect and measure anything within 1.5 millimeters of the center beam and penetrate up to 5 millimeters deep into the tooth surface. Now we will line up the tracking beam right into the center pit. You can see that I have the handpiece nice and parallel to the plane of the teeth, and not leaning to the left or the right, and the handpiece is not up. It is parallel to the tooth surface. If the angle is changed, then the searchlight or beam will be measuring a different part of the tooth surface. It's also important to note that food debris and pools of saliva must be wiped away, but the tooth doesn't have to be dry. A scan only takes 5 seconds, but you need to keep your hand steady and in the exact position during the scanning. Do not move the handpiece at any point while the laser light is pulsing. Wait until the Canary number is displayed and the voice is heard. The plastic tip must remain in direct contact with the tooth surface, and you must hold the handpiece firm and steady in place for the entire duration of the measurement. Rotating or moving the handpiece during the measurement can produce a measurement error, and you may not measure the desired area of the tooth surface. We have a Canary number of 46, so we know that there is caries in the fissure that requires a placement of a restoration. I'm going to accept that number. You decide on how many areas you will scan on each tooth in order to assess the status of that tooth surface. The Canary is like a search beam illuminating a section of the tooth. This means that when scanning, the orientation or direction of the tracking beam will directly relate to the area being scanned. Scanning occlusal surfaces is easy, but remember these simple tricks. When taking an image of the occlusal surface, place the tip on the tooth just posterior to the one you are going to examine, and then lift the handpiece off the tooth surface. This will help orient you to the correct position for capturing an image. Keep the tooth surface dry and free of debris and plaque. Use the tracking beam to help place and orient your handpiece. Keep your hand steady during the 5-second scan.